welcome everyone to the first installment of the Sleep series. This is hosted by Better Sleep Inc. with Dr. Alina, Lyons and Tiffany, Preston. We're really excited to be collaborating with them tonight. And of course, we have Dr. Vincent, Leonti on the chat as well. This will be an ongoing event. We're going to do several topics surrounding integrative functional medicine, plant medicine, cannabis, as well as talking about the oral appliance technology from Better Sleep Solutions. So this will be the first of many series with different topics surrounding sleep. And I'm going to have Dr. Lyons and Tiffany kick it off, and we're going to talk about a few facts and stats about sleep disorders, as well as the fact that this is a public health epidemic, which I did not know that.
So should we start?
Yeah, if you could.
Okay, so I'm Alina Lyons. I'm a dentist from Bordentown, New Jersey, and I've been a dentist for about 30 years, saving people's teeth. But you know, like somebody mentioned, we do not treat just teeth. We treat people with teeth. And for the last few years, we started to doing more. We got engaged with treating people for the sleeping disorders, because we are one of the professionals who are really actually in a patient's mouth and able to evaluate the airway. We got really interested in that, got a lot of extra education. Just like you said, we didn't know it was epidemic. We didn't know it was 50 million people suffering. We didn't know it was 80% are undiagnosed, and only few percent, less than 10, is treating successfully. We didn't know about different solutions for sleeping disorders. You know, CPAP was just one of them. But since that, we found out a lot of other options for treatment. So Better Sleeping, we work with a professional, with a physicians, help diagnosing and help diagnose it and help treating people.
Absolutely, and I thought some of these stats were really interesting that Tiffany provided me. 80% of the population suffers with undiagnosed sleep apnea. And I thought a really frightening stat was more than 50% of sudden deaths occur from obstructive sleep apnea between 10 p.m. and 6 a.m.
The prime sleep hours.
Yeah, that's really scary. And for those of us that don't know what sleep apnea is, we're going to dive into that as well as other sleep disorders.
So I think similarly to Regina's experience, many of the patients that we interact with, and kind of anybody in our walk of life that we interact with and have conversations around sleep, don't realize that they may or may not have an issue. But outside of that, they don't realize the importance of sleep. And we are learning so much about how heavily sleep impacts so many other things, and we'll dive into a little bit more, but what we do at Better Sleep is we're not looking at just the 7-8 hours of sleep that you're getting. We're happy that you're getting those that type of quantity, but outside of that, we're more interested in the quality of sleep, which I think goes unnoticed. And so we look at several different things, but sleep truly is the foundation of health.
Right, yeah. Awesome.
And one of the things that we consider while we sleep is the architecture of sleep. We're looking at the different stages of sleep, including light, deep, and REM, which are things that you hear fairly often, but we don't necessarily know what they mean. And one of the things that we've discovered over the last couple of years is that when we hit that deep sleep, we're actually cleaning. Our brain is cleaning itself. We're getting rid of those toxins. We are creating buckets of memory, things that we need to function on a daily basis to do all of the things that we're expected to do with our bodies. So sleep really, truly is important.
Absolutely, and I thought that this fact was so interesting that when you sleep, your brain actually cleans itself, which I know during certain yoga poses, which I learned from Dr. Vinny, downward dog, that also can stimulate that. But when I heard that about sleep, it just makes me more excited to get more sleep and have better quality versus quantity.
Yeah, absolutely. And as the industry grows, we're learning so much more. But this was a huge thing that we stumbled upon through copious amounts of research. And so to have this information, it would be a disservice not to leverage it to achieve that quality of sleep that we're after.
Absolutely. And I just want to make sure, oh, we have one person in the waiting room. All right. So I just want to introduce our team, our collaboration between Princeton Integrative Health and Better Sleep. This is the PIH team. We're a fully fledged integrative functional medicine practice that offers enrollment into the medical marijuana program, health coaching, cognitive care, cardiovascular care. We have lymphatic massage, chiropractic, as well as acupuncture. So we're a full-fledged wellness center. And Dr. Leonti is on the line tonight. Just wanted to introduce Dr. Leonti. If you don't mind sharing a little bit about yourself, Dr. Vinny, and how you became a functional medicine doctor.
Sure. Thank you, Regina. Thank you, Alina and Tiffany. This is great. I love collaborations like this. So I have been a physician for a short time, only 30 plus years. You know, many of those years I actually spent doing ER medicine, conventional family medicine, until I, as my daughter likes to say, found the light and became an integrative and functional medicine doctor about 4 years ago. I, you know, have my own health issues. Thought life was going along great until I was out for a run. I was a marathon runner, and I developed severe crushing chest pain that made me stop running that day. And make a long story short, I ended up having a cardiac cath, having coronary artery disease, despite being a marathon runner and you know, eating relatively well the American Heart Association diet, which we now know is not the most healthy diet in the world. For those reasons, you know, that was life changing for me, and I eventually found my way to integrative medicine, where I found that I could help many other people. And one of the most undiagnosed conditions for coronary artery disease, for hypertension, for many other things is obstructive sleep apnea. So I'm thrilled to be, you know, talking about this today with this group. And, you know, I think that so much more public awareness needs to happen, and this is just the beginning of it. So thank you, everyone.
Thanks, Dr. Vinny. And I just wanted to highlight what Dr. Vinny specializes in. He has different modalities: cardiovascular care, Del Bredesen cognitive care program, cardiometabolic Bale-Denine method, specializes in gut health. He's a functional medicine practitioner, as well as a registered physician in the medical marijuana program in New Jersey and Pennsylvania. So for those that do not know me, my name is Regina. It's really great to be here with everyone tonight. I'm the community and cannabis educator at Princeton Integrative Health. I've been working with Dr. Leonti and the PIH team for about 2.5 years now. And I'm a medical marijuana patient for chronic IBS and pelvic pain. And when I first started working with Dr. Vinny, not just as his employee, but working with him as a patient, you know, he really helped me in a lot of ways. I was on not a good path. I was on a slew of different pharmaceutical medication, wasn't getting proper sleep. I was having a whole bunch of other host of side effects, but he was really able to get me on the right path. So I'm very thankful that I found Princeton Integrative Health for my own health reasons. But I am passionate about education of plant medicine and cannabis, and helping people heal naturally. I want to introduce the Better Sleep team. So really excited to have Dr. Alina Lyons tonight. If you don't mind telling us a little bit about how long you've been practicing and a little bit of background about your practice. I know you spoke a little bit about that, but if you could just revisit that.
Yeah. So as a dentist, I've been about 30 years. After graduating from dental school, I went to Air Force. I was active duty in Air Force captain, and I was treating people for a few years, but on my own practice about 30 years. I do like it, dentistry, very much, but it's changing. It's a lot of new challenges. And like we got introduced from 2017, actually, American Dental Association said that, you know, we should be more responsible for evaluating airway, and totally agree. And since that, we got a lot of additional education, and even the things which was, you know, we observed the physical attribute to, we observe them, you know, like the scallop tongue, malapathy, long faces. We all saw it, but it didn't connect to the sleep apnea. And just common thing like grinding teeth, TMJ, you know, that's all related. So it's nice to explore different avenue. And I was very impressed with Dr. Vinay about, you know, how the integrated medicine, it's a way to do it anymore, and integrated any medical health, because we're all connected with that. So I'm happy to be a part of that. So we are part of diagnosis, but we also offer treatment in a form for mild and moderate obstructive apnea in a form of oral appliances. That's where my expertise comes in. And also we help people who cannot tolerate CPAP machine and they just don't use it. If they use it and they like it, it's wonderful. But if they don't, then they really have a huge risk. So we offer them oral appliances as a compensation for not able to use the CPAP.
Okay, thank you.
And we couldn't do it without Tiffany. Tiffany is our manager, and she's just helping us, because navigating the medical field is totally different. And this is where Tiffany comes in.
Oh, thank you. It's a great transition, and thank you for sharing your background. And Tiffany.
Hi guys. I actually joined Dr. Lyons towards the end of last year, and it has been incredibly rewarding ever since. We see both sides. Obviously, there is a business component to it where we're working all the way through insurances and working closely with our patients on the financial piece of things. But we work heavily in clinical with oral appliance therapy. And then we also, a big part of what we do and what I love is to lead with education. Dr. Vinny mentioned creating more public awareness, and we could not agree more. We really are here to serve first and foremost as a resource for our patients and for physicians in this field. We consider ourselves the alternative to the CPAP. Of course, there are many people who love their CPAP, and we encourage them to continue use as they see fit. But we prefer to take a more natural approach. So instead of forcing air into the airway, we're offering an alternative with oral appliance therapy, and it's gone really nicely hand in hand with integrative health. Absolutely. So we love what we do, and we feel that we are doing incredibly important work here.
Amazing.
Just to be a part of your team, it's great. It's wonderful.
Yeah. Thank you so much for having us.
Yes.
Excellent. All right. And then Tiff, if you want to kick it off with some information about the 5 major sleep disorders.
Yeah. So Doc, did you want to talk about the different sleep disorders that kind of come across our desk, and sort of what we see, what sparks people to walk into our office and reach out to us?
Yes. I mean, the first thing, people, you find out if they have a daytime sleepiness, they're tired, they wake up with a headaches, they, they're snoring. Snoring is not necessary sleep apnea, but it's definitely obstruction. And we find out from the spouses or partners that they stop breathing at night, and that contributes to all kinds of problems, cardiovascular, diabetes, that affects mentally. I mean, you wake up with a foggy head and you cannot think at all, and people fall asleep behind the wheels while they're driving. It's really scary, but it has a huge impact on them, on a cardiovascular. That's prelude to heart attacks. Between the majority of the deaths, what happens with obstructive sleep apnea happen in the night where they're sleeping, because they get deprived of oxygen, and then it kicks the fight and flight syndromes, and they fight all night long, getting the air, breathing, high blood pressure, and the oxygen desaturation get to the point that they really stop breathing. And it's all different disorders because it's insomnia, sleep apnea, narcolepsy, restless leg syndrome, behavioral disorder, but it's all related to some obstruction, usually with obstructive sleep apnea. It's also central sleep apnea, and they can be, by proper screening, separated, but they all can be treated.
Gotcha. I thought that was really interesting. Many times people don't realize they even suffer from sleep apnea until
It's a lot of, yeah, it's a lot of denial. Like, usually in a younger age, they say it's a 7-to-1 for a man to women, but when we approach the menopause women, the numbers are getting much closer, more even for suffering for sleep apnea.
Gotcha.
So Regina had actually mentioned that not a lot of people realize that they have some sort of sleep condition, or more specifically sleep apnea. But first and foremost, before we even identify sleep apnea as a particular condition that you have, we first have to acknowledge what kind of impact the lack of sleep does to the human body. I think in our early 20s and our mid 20s and our late 20s into our early 30s, we think we're exempt from a lot of different health concerns. And then once we start to fall into the routine and the hustle and bustle of work and family and all of the obligations and responsibilities that kind of pile on top of us as we get older, we start to realize that big ticket health concerns start to surface, and they are oftentimes related to a lack of sleep. And when I say big ticket health concerns, we're talking about big ticket health concerns: cardiovascular health, muscular health, central nervous system, the things that make our bodies function. So before we even dive into sleep apnea, we want to talk about what else is going on with you. And then from there, we also want to understand what sleep apnea really is and what the different types look like.
And that's, it's definitely struck a nostalgic bone in my body when you said that, because I always thought back to being in my 20s where I'm like, I've gone on 5 hours of sleep for the past, I'm fine. I'll be able to catch up with it. But, now being 33, I notice if I don't get enough sleep, I'm getting heart palpitations. My anxiety is through the roof. My vision is messed up. So, yeah, and I'm only 33. So the fact that you said that definitely resonates with me.
And that's exactly why, I would say a lot of the time we have patients come into our office and say, I'm good. I get 7 hours solid, or like I function fine and I have 8 hours under my belt every night. But my question to them is, well, how are those 8 hours exactly? Are you waking up periodically throughout the night to use the restroom? Are you waking up because you're startled by your leg is restless, or is your anxiety through the roof? Are you waking up with headaches even though you got 8 hours? There are so many conversations around the serious impact of the lack of sleep that goes kind of unnoticed. So first and foremost, we definitely want to be cognizant of what goes on when we're not getting the quality of sleep that we need.
That brings me to my next point and question is, and we had a conversation about this earlier this week, which I thought was interesting. So it's not necessarily about how many, because I'm sure you get a lot of questions from patients saying, if I get 7 hours of sleep, is that okay? Or if I'm, is there a difference between hours that males and females should receive? But really it's about like you said earlier, the quality of sleep that you're getting. You don't necessarily look at the number of hours.
It really is about the quality, because you have to imagine that everyone is from a different walk of life and everyone has a different professional obligation or just a different schedule. We treat a lot of first responders that have shift schedules, who are not necessarily have traditional or healthy sleep habits from the jump. So it's combating those and then talking about quality fitting within that. And it's possible that we can make the quality of sleep outside of traditional sleeping habits more beneficial and more, substantial. But it's important to remember that just because you're getting enough hours doesn't necessarily mean you're getting the type of sleep that your body needs to do what it has to do every day.
Gotcha. Thank you.
So I had mentioned that, before we dive into sleep apnea, it's important to know the major health concerns that start to arise when sleep apnea or other sleep conditions are not treated properly. Doc, can you shed a little bit of light on what sleep apnea is and what the two different types might consist of, or what symptoms might, surface, or what we want to be on the lookout for?
Sure. So one of the things I want to mention a little bit earlier, that most of the patients, it's a stereotype, who has a sleep apnea? Oh, I know who has a sleep apnea. They have to be big, they have to be unhealthy and that. And it's not really true. We're finding out, totally fit people, totally skinny people, it's a hereditary factor. A lot of physiological factors, just the anatomy, just shallow floor of the mouth, large tongue, flat face, long face, it's all contributor because it deprives of a proper airway. So we distinguish between two different sleep apnea: obstructive sleep apnea, meaning obstruction of the usual. When you fall asleep, the tongue is relaxed and fall back to your throat and obstruct this. Then you have a cessation of the breathing. So during this time, in any sleep study, they look for episodes of apnea and hypopnea. Apnea will be episode when you have for 10 seconds or more stop breathing. It will literally feel like you have a cork in your throat. And hypopnea is like for 10 seconds or more, you're struggling to breathe. So in all this assessment, all this sleep study, they look for episodes of apnea, hypopnea. They divide this, how many times it happened during sleep, and they divide by the time of the sleep, and they come up with an index. And usually it's like between 0 to 5, it's a normal, between 5 to 15 is a mild, 15 to 30, it's moderate, anything above 30 is severe sleep apnea. So, so this is obstructive sleep apnea. The central sleep apnea, that's your brain is telling you not to take a breath, but it's usually related to underlying condition, and that maybe require different study, more in laboratory and all that, but most of the time they're actually related to each other. So when people stop sleeping and a partner's just wake them up, they're saving their life, actually restart them.
Wow, that is crazy. And then the next slide, I have some symptoms of the sleep disorder. So does one have to exhibit all of these symptoms to be diagnosed with sleep apnea?
No, absolutely not. So, it's important to give an assessment form to the patient, to every patient, because there will be a question asking, like usually they're like, if I don't snore, I don't have a sleep apnea. That's not necessarily true. So, just simple Epworth scale, questionnaire, it prompts us when we score that to know if the patient should be evaluated further.
Well,
but it could be all of that too.
Could be all, it could be just a handful of those. Typically when people walk into our office, they're experiencing at least one of these things combined with clinical characteristics. Dr. Lyons, being in the oral cavity all day, is able to identify those, and then the conversation sort of starts. So from there, we really use it as a jumping off point to find out what else is going on.
Gotcha. I think there are some questions in the chat. And we're going to, and don't worry everyone, we're going to take questions at the end and we'll definitely address these as well. Don't worry about that. And here's some of the, and could you please speak to some of the issues that can lead to if you let sleep apnea go untreated?
So one of the things that not many people realize is kind of going back to the conversation where when you're younger, you think you're exempt from those health concerns. But the older we get and the more life things that sort of get piled on us and then the big ticket items start to arise, we realize that left untreated, it actually continues to get worse. So when you walk into our office as, you know, a 20-year-old, a 30-year-old, and you have normal to mild sleep apnea, we would love to treat you now. We would love to treat you now and make it a manageable condition. When you come to us and you are in the severe category because we've left it untreated for so long, it's working in conjunction with so many other underlying issues that at that point you would be a CPAP candidate. But we really truly work through so many different, I consider it a spoke on the wheel. Oral appliance therapy specifically is considered a spoke on the wheel. We see patients who are often experiencing a lot of other things. So we want to work alongside that and make sure that we're working to manage it. At that point, it becomes a management system.
Gotcha. Sorry about that. Okay, let's and here are some pretty surprising stats and facts about sleep apnea. So we discussed this earlier this week. Nearly 50% of middle-aged adults snore, and 30 million Americans snore. 1 in 5 adults have fewer than 10% get diagnosed. So those are pretty surprising numbers.
I would say, and I heard it from Doc first. She, you know, being kind of newer to dental sleep medicine, I've had so much to learn from Dr. Lyons. And one of the things that she taught me initially was that snoring categorically used to be a lifestyle disorder. And now we're finding that it certainly is not. It is a medical condition, typically. We find that it works alongside of other issues that are happening. So.
And it existed as a, you know, they didn't have a solution for it. It was just acceptance of that. But now we can have a solutions.
Wow.
We can stop that.
All right.
So, so as Dr. Lyons mentioned, we prefer to start with assessment. What we do is, and it can be just as simple as having a conversation with your practitioner or your physician about your daily habits, about your sleep habits. And then it could also work in conjunction. We have a form that works really well and gives us a baseline for what's going on with you during the day, and what may or may not be related to sleep. That's truly what we consider an assessment. They're cardiologist crafted questions, and we just learn a little bit more so that we have a baseline to say, okay, a diagnosis would be a good next step. At that point, diagnosis is the key. It allows us more insight into what's going on while you sleep. So we're looking at that quality. We're looking at your oxygen levels. We're looking at the architecture of sleep. We're looking at those sleep stages specifically in conjunction with what side of your body you're sleeping on, so that we can also differentiate between the two types of apnea that Dr. Lyons had mentioned. So the diagnosis piece is really where we gain insight into what options and where to go from there.
Okay.
I have to say that, like, we're like detectives when we get the sleep study back, because it analyzes, you know, like it's all different type of the home study test, because they usually are really right now excellent ones. I have with me, I don't know if you can see. This is a home study test on one of the newest from WatchPad disposable unit. You just wear as a watch, one probe and one sensor which you put on the chest. Patient sleeps for the night, and within 24 hours, we have a diagnosis and whole report from a board certified sleep specialist. And we look at that and we just like, oh, we know how you slept, how long was your light sleep, deep sleep, REM, did you, how you move, and it's just your position and what can be done, how your oxygen was, how your blood pressure. It's really interesting.
It's really cool, and the patients love to see it too because it is so in depth, but it's accessible information. It's pie charts, and it's really broken down, and it really is easy to deliver the information and say, okay, maybe you don't have apnea going on, but your pie chart is primarily yellow, which means that you're getting mostly light sleep, which means you're not quite reaching that state of deep sleep, and your brain's not doing that thing we talked about where it's washing in like waves in and out to clean itself, to develop memory and get rid of those toxins. And then, it allows us to look at the apnea scale as well. So once we have that index, we can really dive into the next part, which is treatment options.
And just to drive this home for those of us that, so I know we're throwing a lot of information out here, the assessment is as easy as taking a sleep test that you can take home with you. It looks like a little iPhone watch. And even if you aren't snoring, there's so many things that you can learn about your sleep cycle through this test. So.
Absolutely. Bless you.
Bless you. All right, and if Dr. Lyons or Tiff, if you'd like to just explain for those of us that are unfamiliar with, current recommended therapy, which is CPAP, and why Better Sleep offers a better alternative.
Regina, do you mind if I jump in and answer the chat?
Oh yeah, sure. We have a chat.
Yeah.
Sorry about that.
No, that's fine.
Okay. So CPAP, it's a continuous positive airway pressure. So it's a mask. People wear it. It has to be adjusted to the person, it has to be fitting properly. But it's a continuous airway. So you will get the airway. It's actually, they started that with, when they started studying that, they used the Eureka vacuum cleaner. And it works because they push a lot of air and the person can breathe. So if somebody can tolerate that and they use it, that's a golden standard for getting air. But unfortunately, they know in American Academy of the Sleep that only 40% of the people who have a CPAP use it, love it, and very successful. Unfortunately, other people, they don't use it daily. They use occasionally. They don't, or it just ends up under the bed, like, a lot of famous people, like the sports figure, the judges, they died because they had a CPAP, but it was under the bed. They didn't use it. So you're talking about efficiency. Efficiency, it's like if you have efficacy times compliance. So if you use the CPAP and you wear all the time, you're going to have 100% efficiency. But if you use only like 40% and 40% of the time and it's 100%, so you're utilizing only 40%. Oral appliances, they design, and these are all individual for each person. It has to be different and with different parameters, and also titration system that we can advance or take it back. So they usually run in a range between 75 to 80% efficiency. Now, if you wear this all the time, the performance with the oral appliance is better than with a CPAP if you use it only occasionally.
Gotcha. Okay. Thank you for sharing that. And then the oral appliance is the better alternative, and it's specifically designed mouthpiece that fits your teeth. It's custom made for you.
So in our practice, we don't even take impression with skin, because then we get a very accurate, the technology now is so advanced. So we scan oral cavity, we scan the central bite, then we scan the protrusion and design appropriate appliance, because they can be different. And then it doesn't end that we just give appliance and it's over. No, our therapy is goes for 3 months, because we see patient initially a week later, 2 weeks later, and we go through stage of titration. I have to tell you, like, really quick story. We had a lady, she was severe and she could not tolerate CPAP. She would never wear it. And on the snore scale through the Snore Lab app, her snoring was pretty high, like 180. Her grandchild didn't like it because she snores so much. She said she's not going to use the CPAP. So she came, we made the oral appliance, literally with 2 adjustments, 2 different titration. We got her in a position that her snoring is in a single digit. It was 8. And she says, and she never slept that long in her life, over 7 hours. So right there, it's just like, tremendous success story for her and for us too.
Oh my gosh.
And we have different story too. Like, we had like very fit guy. He's the policeman. He comes in, he said, Doc, I just want to sleep with my wife. I snore so much. So we helped him too. 2 weeks later, he's like, thank you. I'm back in the bedroom. So,
Oh my God.
it's nice to be a part for solutions,
Yeah, and this definitely looks less terrifying than wearing, the CPAP over your face, the face mask. This looks definitely more user-friendly.
I think a lot of people don't realize that there is an alternative, and that's our specialty. We are the alternative to the CPAP, and so where the CPAP is forcing air into your airway, we've taken a different approach by leveraging what our bodies do on their own, which is breathe, and we've leveraged that and created this, oral appliance to open up the airway when we're in the resting state, when, our airway isn't as accustomed to doing it on its own, or when we have identified an issue with breathing. But we truly consider it the alternative to the CPAP. And we actually find that most of our patients are interested in pairing oral appliance therapy with other integrative approaches. And I would say that oftentimes it actually works out in their best interest to continue business as usual with their other holistic approaches, because what do we know about medicine? When you load up on pharmaceuticals, you get a pharmaceutical reaction. And when you take a more natural approach and you're taking it into an oral appliance kind of therapy, it is paired nicely with other holistic approaches.
So this, actually, I have another question that just popped up in my head. So often do you see when patients come in, would a typical treatment plan, in conventional medicine, do you see patients coming in that do not look into being diagnosed with sleep apnea, but they are solely relying on sleep medication? And can that make things worse?
Yes. We actually see that quite a bit. One of the questions that we have in our consultation portion is, what kind of medications are you on? What are you doing to combat the things that you've identified are issues? And how might we be addressing those through oral appliance therapy? A lot of the patients also, once they have identified sleep apnea, it creates such anxiety in them when they finally lay down to rest that they have difficulty falling asleep. So it's kind of just, it's just science if you think about it. Pairing oral appliance therapy with other integrative approaches that may allow you to fall asleep easier or may be specifically sleep focused just makes sense. It just does.
Another quick question. Have you seen patients able to reduce sleep medications?
Yeah, I had a patient recently who said that he never relied on sleep aids, and then he found himself kind of just swigging, like no dosing, nothing, just swigging from the ZQL bottle to get that night's sleep. It had later been identified that he had sleep apnea. Now we're effectively treating him with an oral appliance, and it's going really well. If he were to surface with other anxieties or issues with sleeping, we would then, pursue integrative approaches.
So our therapy is consists of seeing patients for, titration, but also after we find this right spot for them, that they're doing really well with appliance, we wait about 3 months. And after 3 months, we repeat the sleep study, because that usually shows very different numbers. And at that time, we keep a tight contact with the primary to maybe they have to be reevaluated for blood pressure, because it may be changing for diabetes. These things change. With sleep apnea treatment, people lose weight. It has a lot of benefits. So they're evaluated and finding out that they improve overall.
Well, thank you, Dr. Lyons and Tiff. This is so insightful. It's really great information for people that are suffering from lack of sleep. So I just want to transition, into, so using integrative functional medicine and plant medicine and cannabis for insomnia. So we talked about obstructive sleep apnea. You may not realize that you have it. And a lot of these factors are play an important role in sleep deprivation, stress, poor sleep habits, diet, eating late at night, which is what I'm very guilty of, vitamin and mineral deficiencies, mental health disorders, medications, other sleep-related disorders, which we just discussed, sleep apnea, chronic pain, hormone imbalance. At Princeton Integrative Health, a part of our functional medicine toolbox, or what's in our arsenal against sleep deprivation, is some of our functional medicine testing. So we truly believe in finding the root cause to an issue, not just putting a Band-Aid over an issue like taking a sleep medication, but truly finding what that root cause is. And hormone imbalance. This is something that could be causing lack of sleep. And Dr. Vinny, if you don't mind discussing a little bit about what the Dutch test is and what hormones it looks for and how it can help a patient identify maybe this is an issue for sleep. Oops.
Yes, thank you, Regina. So the Dutch test, Dutch stands for dried urine test for comprehensive hormones. So it looks at both the reproductive hormones, as we all think of hormones, estrogen, progesterone, testosterone, DHEA, but it also looks at cortisol, a circadian cortisol, meaning a rhythm of cortisol throughout the day. So how this can, there's a couple of things that it can tell you, people who are having trouble sleeping. Some people, it's a problem with their circadian cortisol. Cortisol should, when you wake up in the morning, it should be low as just as you're waking up, but then it should rise rapidly to a peak in the morning to get you going for the day, and then come down gradually into the afternoon, and then kind of slide to again a low in the evening so you can fall asleep. Many people have problems with their cortisol. They may, for some people, their cortisol may start rising in the evening and be higher in the evening than it is in the afternoon, for example, and those people have trouble falling asleep usually. Or for some people, because of metabolic disorders, things like diabetes, prediabetes, stress, what may happen to those people is their cortisol may rise in the middle of the night when it should be at a very low level and wake them up. And they're like, geez, I have no idea why I'm waking up in the middle of the night. Sometimes that's related to what they're eating at night. So if they eat too late, if they eat something sweet, something with a lot of sugar or carbohydrates, body puts out a lot of insulin at that point. And then in the middle of the night, when the sugar comes crashing down, the body compensates by putting the cortisol to get the sugar back up, and boom, you're awake. Some people even, especially women, might even wake up with night sweats at that point, especially if they're in that perimenopausal area or even menopausal. So all night sweats or even sweats during the day are not always related to estrogen. They could be related to cortisol. So that's, usually you have to work not just on the reproductive hormones, the estrogens, but also the cortisol when you're working on the night sweats or night wakings, if you will. And then the other thing that the Dutch test tells us, as I mentioned, is the levels of the reproductive hormones. And many people, men and women, as their hormones start to decline, obviously for women, it's a much sharper decline around the time of menopause. A lot of women have trouble sleeping at that point. Whether it's from night sweats or just sleep just gets disturbed by those low hormones. And, there are some ways to deal with that, some with supplements and that kind of thing, but also some women choose to choose to research bioidentical hormones. And for some women, that really helps them quite a bit. So, that's certainly a whole different topic of discussion, but that's some of the information we can get from the Dutch test as to what might be, how that might be playing into sleep disorders.
Thank you, Dr. Vinny. That's such great information. And I remember when I first took the Dutch test, a couple years ago, when you were reading my results, my cortisol was through the roof in the morning, and I kept waking up throughout the middle of the night. So I didn't even know what cortisol was. So this stress hormone, it plays a huge role in so many things in your body, as well as sleep, stress, and weight gain. And there is a correlation that many people with insomnia may have high cortisol levels at night, and it's associated with increased number of nighttime awakenings. And we're going to say something, Dr. Vinny?
Well, I just wanted to say that if people have sleep apnea, probably their cortisol is going to be high at night because it's a stress response. And there's probably nothing more stressful at night than not being able to breathe, or even during the day for that matter. I mean, if you have trouble breathing during the day, you're pretty, your cortisol levels are pretty high. So, but obviously this happens a lot more at night when people with sleep apnea. So that could be a reason that cortisol levels are high. So if somebody tells you that, you probably should be getting a sleep apnea test.
Absolutely. So hormones play a huge, huge role in our overall health and wellness, and you can get a great snapshot of what's going on through the Dutch test. If Dr. Uni, if you don't mind talking a little bit about another test in our arsenal against sleep deprivation and just to help with overall wellness, the micronutrient test, because does vitamins and minerals, do they play a role in our sleep cycle and how well we can fall asleep and stay asleep?
Sure, the micronutrients, the vitamins, the minerals that we need, the amino acids, glutathione, all of that can help with our, both our cortisol, our detoxification, and that's all important in how we're sleeping. Vitamin D is probably what, we call it a vitamin. It's actually a prohormone. It affects about 1,000 different genes. If your vitamin D is not right, I believe it's hard for people to sleep very well. So that's something that we assess in our practice, and is certainly one of the things that can, having the proper vitamins, minerals, and other nutrients can certainly help play a role in getting more restful sleep.
Absolutely. And just to emphasize, like Dr. Vinny said earlier, there's been several studies that link vitamin D deficiencies with sleep disorders, especially obstructive sleep apnea and short sleep duration.
And if that isn't enough reason to take vitamin D, know that there's evidence that if you have a good vitamin D level, you're less likely to get COVID. And if you do get COVID, it's less likely that you're going to get critically ill, need a ventilator, or die. So I would recommend taking vitamin D during this time of COVID uncertainty.
Yes, thank you, Dr. Vinny. I vote staying alive too. I like that.
Agreed.
That's what we're all here for.
Why we're here.
And then and thank you, Dr. Vinny, that was really insightful. And just to another aspect of vitamin deficiencies, vitamin B6 and B12, they're involved in energy production, but they're also important in the production of that natural hormone that we produce that's involved in deep cycle melatonin. So these vitamins B6 and B12 are also important, which you can find on micronutrient testing as well. So we talked about functional medicine testing in our arsenal against sleep deprivation and other chronic illness. And we're not going to talk too much about supplements today. But when you book an appointment with Dr. Leonti and he goes through your medical history, he's going to make some recommendations on hormonal supplements as well as herbal supplements that can help sleep. And some of the supplements that have been really beneficial for me for managing cortisol contain ashwagandha indica. This is an herb that can help reduce sleep. It can help improve your sleep cycle. Valerian root is going to be another popular herb. Some of us might be familiar with some of these, like chamomile. We might have a nice chamomile tea at night, or lavender is excellent sedative. So these are natural herbs that can help our bodies prepare for sleep, and you're going to find these in the supplementation that we recommend. Here. So another huge element in our toolbox against sleep deprivation is cannabis. So if we can't help you through diagnosing sleep apnea, if herbal supplements and balancing hormones doesn't work, cannabis will definitely improve your sleep. And here are the qualifying conditions in New Jersey. They are similar in Pennsylvania. Dr. Leonti is a registered physician in both PA and New Jersey. So sleep is not a qualifying condition, unfortunately, but so many of these chronic issues, sleep is going to be a side effect of chronic pain, of migraine headaches, of anxiety. And we're not going to cover on how to enroll. If you have any questions, if you are interested in becoming a medical marijuana patient, where you will have access to various strains that will have different levels of CBD or THC, please book an appointment with us. You can give our office a call and we can walk you through what the process looks like. So let's talk about cannabis and how, when you pair it with integrative functional medicine and you pair it with the options from Better Sleep, how they can improve our sleep. So let's start off by talking about the endogenous cannabinoid system that every living being, everything with a vertebrae, contains this important system. And it plays a major role in various different human biological processes such as fertility, mood, memory, and sleep. So this system is made up of, I just want to make sure you can see this. I'm going to move the video over here. This system is made up of three components. Endocannabinoids, which are substances that our body produces, and these substances, they're similar to what's found in cannabis strains, which are phytocannabinoids. An example of this is anandamide. This is a substance that actually, the molecular structure looks very similar to THC, and this is something that we produce on our own. It's nicknamed the bliss molecule because it helps regulate our dopamine and serotonin levels, and it gives our bodies a sense of overall well-being. So endocannabinoids are a part of this endocannabinoid system. The receptors, cannabinoid receptors that we find throughout our entire body, are also an important component. The CB1 and the CB2 receptor are the most prominent. We find them spread throughout organs, throughout the surfaces of our cells, our tissues. The CB1 receptor is found prominently in the brain and the spine, and it is engaged by THC the most. So we may be familiar with the term THC. It's the most abundant cannabinoid found in the cannabis plant, and it possesses a myriad of different medicinal benefits. So when we consume phytocannabinoids like THC or CBD, these cannabinoids, they actually fit like a perfect key and lock with these receptors. And not all of them are psychoactive. So THC commonly produces psychoactivity. It's stimulating and produces euphoric effects, but you'll notice that it's really primarily the only cannabinoid found in the plant that does produce these effects. And we're still discovering the receptors in our body as well as different cannabinoids found in cannabis. And this slide demonstrates the ideas that we just talked about. So cannabinoids, they're found in substances that our body naturally produces. So endocannabinoids like anandamide and 2-AG, and they're also found in plants. So cannabinoids, they're these fatty molecules, and there's over 113 of them. You'll notice that the state of New Jersey will test for 4 of them, which we're going to talk about. You'll notice that this little diagram depicts their affinity to bind to receptors. And I found this on leafly.com. This is a great resource when it comes to cannabis education. It's like the encyclopedia of marijuana. So I mentioned there's over 113 active cannabinoids found in the plant, and we're discovering new cannabinoids every single day. THC is the most abundant, targets nerve pain, nausea, vomiting, mood. It can have anti-tumor effects. CBD, which we are going to highlight today, cannabidiol, is garnering a lot of media attention because not only is CBD found in medical marijuana, but hemp-derived CBD is very popular, which you don't need a medical marijuana card to purchase. CBD is very helpful with pain. It possesses extremely high anti-inflammatory properties. It helps modulate the immune system, also acts as a bone stimulant, can regulate our blood pressure. And my favorite one is that it's highly neuroprotective. There's clinical studies that show that CBD can rid the brain of that fatty plaque deposit that causes Alzheimer's disease. So if you are someone that is looking to incorporate more neuroprotective qualities in your natural routine, I recommend incorporating CBD. And if you're unsure, should I use medical marijuana? Should I just be using hemp-derived CBD? Give our office a call, and we book complimentary 20-minute discovery sessions so we can talk about which avenue would be appropriate for you. We're not going to talk too much about CBG today. This cannabinoid is found, it's considered a minor cannabinoid. It's found in very small amounts in the plant, but it is extremely helpful when it comes to musculoskeletal issues. It can act as a digestive aid and can help target tremors in those of us that maybe have Parkinson's disease, ALS, or MS. So I want to put the spotlight on CBD. There are several studies supporting the fact that CBD shows promise and potential in helping patients fall asleep. The Permanente Journal published a Grand Slam study. 72 adults were participating in this study, and they were administered 25 milligrams of CBD in capsule form. Those that predominantly had issues with anxiety, that felt that the anxiety was causing them sleep issues, they were given the capsule in the daytime. People that said that the participants that had issues predominantly with sleep, not necessarily anxiety, they were administered the dose in the evening, and they found that anxiety decreased in 79% of the people, and 66% of the participants indicated they had less trouble sleeping. So CBD is really the cannabinoid that I want to emphasize that's great for helping you fall asleep. And THC is great as well, but we're noticing that the ratio is going to be higher CBD and taking the minimal amount of THC to show optimal benefit. It's not just about the cannabinoids, those fatty compounds that possess all those medicinal benefits that we just covered, but the terpenes are also extremely important in targeting sleep.
So sorry.
Oh, no, that's okay. No problem. Terpenes, they are the aromatic compounds found in cannabis. They're not just found in cannabis strains, they're found in all herbs, fruits, and vegetables, and there's hundreds of them. They fine-tune the effects of cannabis strains. So for instance, linalool, this is found in the strain Grape Ape at Breakwater. It's also found in various other strains in the New Jersey Medical Marijuana Program. And it's also found in English lavender. It's extremely effective in reducing anxiety. It can act as a muscle relaxant, and it's been used in traditional medicine for a very long time to treat seizure disorders. So linalool is an aromatic compound that you will find in cannabis. Myrcene is also extremely helpful. It's not only sedative, but it helps maximize the effects of the cannabis strains because it has an effect on the blood-brain barrier. It allows more CBD into the bloodstream at a quicker rate. So if you see strains that are high in myrcene, or maybe you noticed some CBD companies that are incorporating myrcene into their ingredients, it's because of those sedative and maximizing effects. Pinene is found in the sticky sap in pine needles. You'll also find it in strains in the medical marijuana program. Extremely anti-inflammatory, can act as a sedative, and also increases lung function because it acts as a bronchodilator. So the cannabinoids like THC and CBD, they're very important, but these essential oils that fine-tune the effects of the strains are significant. They create significant impact as well. And the reason why I want to highlight terpenes is because they have it interacts specifically with the GABA activity in our brain, gamma aminobutyric acid. It's a naturally occurring amino acid that works as a neurotransmitter in our brain, and it inhibits certain neural activity that helps us reduce mental and physical stress, and it plays an important role in our sleep cycle. So many terpenes, like the ones that I just highlighted, they interact with this GABA activity in our brain. So I will be wrapping up this session, and I just want to emphasize that, you know, the therapeutic benefits, they're really countless when we pair the holistic approach of the oral appliance therapy with integrative functional medicine and plant medicine, because sleep is truly the foundation of health, and it's really easier than ever to leverage these two schools of thought. So just to reiterate, what's in our toolbox with our collaboration is the oral appliance to help as a better natural alternative to help fight sleep apnea, sleep hygiene and education offered by Better Sleep. With Princeton Integrative Health, it's incorporating herbal supplements, nutritional supplements, supplements to balance your hormones, as well as cannabis and other energetic therapies like acupuncture and lymphatic massage, which we didn't touch base today. We do offer that at Princeton Integrative Health, and that's something that we will cover in the future installments of this sleep series. So I just want to, Now I want to field questions. We'll take questions. I know I had some in the chat earlier.
And Regina, we just want to say thank you so much for highlighting the fact that oral appliance therapy and holistic approaches with CBD and medical marijuana are kind of, they run parallel and they work really well together. We appreciate being part of this, and we feel very similarly. So
yeah, thank you.
Yeah.
Thank you so much for collaborating with us.
Yeah, we can offer patients. Our basic thing is to open airway, and you guys with everything else, it's just wonderful.
Thank you. It says, so what can you do regarding temporary lack of sleep, either from temporary heavy workload at a job, temporary worry or stress? So how, Dr. Lyons and Tiff, what would you recommend to a patient that comes in that may not necessarily, or they're saying that they're just starting to exhibit these temporary lack of sleep signs? Would you automatically say, let's do a sleep test?
So we would start with assessment. That kind of gets our feet wet and understands a little bit more. Typically when someone comes to our office and suggests that they're just starting to experience these things, we find later that these things have always existed, but maybe they're more cognizant of now. So we really want to start with assessment and then diagnosis, and have them complete that home sleep test so that we can really see what's going on and look at the bigger picture. Because what we know about sleep being the foundation of health is that it is really critical to good overall health and wellness, which means the picture is much bigger than just what we're experiencing right now. It could be the result of something we've already gone through or something that our body's transitioning into. So the diagnosis piece really allows us the insight into see what's going on.
Perfect. Very insightful. Just wanted to take some questions. Does anyone have any questions in the chat? I can unmute you. Oh, we have a question from Kate. I'll actually unmute you. Not sure if that's, oh, sorry. Messing this. There we go.
There you go.
Hi, Kate.
I just wanted to know, I typed, can you give me the contact information for Dr. Lyons and Tiff? I mean, I'm already diagnosed with sleep apnea. I already have insomnia, and I've already failed CPAP. I can't use it. So,
We can
and so I'm interested in the dental thing.
Yeah, we can certainly help. Dr. Lyons is one of the few dentists that specializes in oral appliance therapy, which is kind of bizarre to think about because she really spends, and all dentists do, spend their time in the oral cavity, right? So they're the experts in their field. But she's really jumped in with 2 feet, and it is a specialty, and she's really an expert. So we will get you that contact information. We can help.
Great. Good.
All right. Does anyone have any other questions for Dr. Lyons or Dr. Leonti? Questions? All right, I will be sending everyone the slides that I use as well as the recording. It doesn't look like anyone has any questions. Perfect. All right, well, thank you so much, Dr. Lyons. Thank you, Dr. Leonti. Thank you, Tiffany, for joining me for this informative, insightful session tonight. And we look forward to the future installments of the Sleep series.
Yeah, we actually look forward to hopefully diving a little bit deeper into the WatchPat 1, the home sleep test, and maybe pulling in our technical expert to go over those 7 channels that we look at, and maybe we can even get our audience hooked up with a WatchPat so that we can sort of go through those results together.
Perfect. I love that.
Thank you very much for us to be part of your program. That's great. Thank you.
Thank you.
Yes, thank you. Thank you for being here. We love the collaboration. We love, you know, really, as you mentioned, people are only really going to get healthy if professionals collaborate. And collaboration with dentists and physicians is long, long overdue and still very much not being done. So
we're doing it.
hopefully this is
We're
a beginning.
We're on the way.
Yes, and we're doing it, and we're going to be pushing that message with other dentists and other physicians. So yeah, and if any, you know, any of the patients who signed on for our practice, you know, if they need any help finding Tiffany or Dr. Lyons, we can certainly help you with that also. So I saw they dropped it into the chat, so you can get it there. But if you lose the piece of paper you write it on, just give us a call and we'll point you in the right direction. So
absolutely. All right. Thank you, everyone. And
thank you, Regina, for putting this together.
Thank you. Have a great night.
Bye-bye.
Okay.
Take care.
Bye.